Okay, so Marsha Stedman is going to help us connect the dots a little bit about how what's happening at the national level really matters here, and how all of the work that we're doing here in our state matters at the national level, because right now we are moving into a position where we can really lead the way and make something very significant happen in the universal healthcare movement. So Marsha Stedman is the president of Healthcare for All Washington. She spent the majority of her professional career in customer service management at a small European travel wholesaler. In that role, she specialized in resolving a variety of customer issues, such as the language barrier for Americans in Paris, and the comfort of the hotel beds, whether too soft, too firm, or too small. Oh, of course, there were also more serious problems that required negotiating with the company's vendors and suppliers in order to reach an outcome acceptable to the customer. I think those skills are coming in handy. She sometimes wondered when she would have a real problem to address. So she's working hard. So now that she has retired, she retired in 2010, it coincided with the continuing debate around the Affordable Health Care Act, and what that real problem was staring her in the face. So inadequate and unaffordable access to health care for so many Americans. So mindful that the Canadian universal healthcare system began in one province, Saskatchewan, she searched for an organization working for state-based universal healthcare and found Healthcare for All Washington. She became an active member in 2011, joined the board of directors in 2014, and was elected president of the board in 2016. So, Marsha, welcome. I know you are putting those problem-solving and negotiation skills to good work. You are meeting with people on a regular basis that are moving the gears in our legislative system, so help us connect the dots.
Thank you, Kaya, that's great. So yes, we have a system of healthcare that's really a non-system. The system is in that picture up in front of you there, that graphic. We have too many hoops that we have to jump through now, and there's a way, we have a solution that would simplify this. You can see that instead of all those little monitors and everything on the left side, we could have just single-payer healthcare. And how are we going to get that? Well, it very well may happen that we get it on a state-based level first. And I was really heartened to see Pramila Jayapal mentioning that very thing in her remarks that she's made recently. She made remarks at the healthcare forum that healthcare is a human right put on last month, or no, actually in late January now. And she mentioned how she's working hard on the national level, but the state-based efforts are really an important incubator for things that can happen on the national level. So I'm here wearing two hats, really. The Healthcare for All Washington hat, and also the Healthcare as a Human Right Washington campaign hat. Because we realize that to get this campaign going and off the ground in both nationally and in our state especially, we need to have a unified campaign with all sorts of organizations that are working on this same issue of universal health care, working together under the same, together as a team. Every organization has its own strengths to bring to this movement, and we are hoping to, so pleased actually that the North Seattle Progressives has signed on to become an endorsing member of Healthcare as a Human Right, the campaign for single-payer healthcare in our state, and also nationally. So with that, let's see. Okay, so just to cover what the State-Based Universal Health Care Act is that would help us with our financing to get through to the get access to the federal monies to have our state plan be enacted. We depend on the State-Based Universal Health Care Act. That would be a blanket, it would enable the federal support, both financial and regulatory, so that we could really do something on our own in our own state. One good thing about the bill that Pramila Jayapal introduced, this is a separate bill from the National Improved Medicare for All Act. Last year she introduced this accessory bill that would give states access, and it's being sponsored this year by Ro Khanna, a representative from California, so she spun that off to him or her. not sure who that is. I haven't seen a picture of that person yet, so that person. It would free up those dollars, and we're depending on that for our state-based plan to make some traction. So let's see what's going on. So, what's going on in our state?
One second. I'm passing out a handout for a little bit more information about the state-based universal health care plan.
Oh, thank you.
I just sent out a handout. If you're on the healthcare committee, could you just we don't quite have enough for everybody that's here. So if you're on the healthcare committee, you will get we'll email you a copy of the handouts. But if there's just a little bit more detail there on that first side, and then on the back side, phone numbers for the rules committee.
Thank you. Okay, so that leads into the next area, which is our state plan. So we have some really good news, huge news to tell you about, which is there is a bill called the Pathway to Universal Health Care Bill, and that has the number 5822 in the Washington State Senate. Our allies in Healthcare as a Human Right and ourselves in Healthcare for All Washington and many other organizations went down and testified both at the Senate Healthcare Committee and in favor of this bill. Healthcare for All Washington was really instrumental in selecting some areas for improvement in this bill, so that we identified there were five key areas. One was to include patient advocates and healthcare community advocates in the work group that would be in this committee to help set up a universal health plan in our state. This bill is actually a study bill, and it would enable a work group to be set up to study how we could provide universal health care in our state, the best system from others around the world. And so it would, it's important that this bill really also outlines that healthcare is a human right. It states boldly. The legislature declares that healthcare is a human right. And given the problems in our state, the 400,000 people that don't have health insurance and people that have deductibles of $7,000 or more on an annual basis, can actually get something better that will actually give them access to health care, not just health insurance. So this bill was improved in areas about makeup of the work group. Also, that it would include consideration of a publicly funded and publicly administered plan, not just a plan administered by insurance carriers. That it would include doctors in the work group as well for fair compensation. And also, it was already in the bill that insurance carriers would be there, included in the makeup of the group, so that we could get buy-in from all sectors, including persons, minority persons, just a wide array of stakeholders. We all have a stake in this legislation. So, so what happened was we had this great hearing in Ways and Means. The Healthcare Committee passed the bill out of its committee into Ways and Means in the Senate, and we had this opportunity. We didn't get any of our amendments passed in the Healthcare Committee, but we had these wonderful advocates in the Senate that were instrumental in helping us get the bill amended in the Ways and Means Committee. And this is where they consider the financial aspects of the legislation under consideration. So what happened was they had a whole bunch of bills set up to be considered at once, and two of our co-sponsors, Senator Focht and Senator Hasagawa, pulled the bill from its order in the lineup. And while the rest of the bills were being discussed, these two senators worked the language up until the very end of the session. And then what came out of that session was something that looked a lot like what we had recommended. I want to go through here. Yeah, it was just, this is like huge. Yeah, we have actually made some good progress. And the way, the way we did that, actually, I can talk about that a little bit. The way we did that was by counting on our allies to testify in favor of it. We had the help of the people in healthcare as a human right. There was David Loud there, who was a convener of the newly re-energized group. He spoke specifically in favor, to the point that Pramila Jayapal's state-based Universal Health Care Act is mentioned in the bill as the way to do the financing. After we get, after the revolution, when we get Democratic control back in the federal House, Senate, and in the presidency, hopefully. So in 2021. So that every bill that we've seen so far has a 2-year rollout. So it's not going to happen overnight, any of this reform. But we need to get the ball rolling now. And this bill, this pathway, offers us a way to do that by systematically, methodically looking at all the aspects, getting input from all the stakeholders in the system to come up with the best plan, and then to make a financial analysis, an actuarial analysis. And that was specifically included in the bill as well. Plus, they have a deadline to report in November of 2020. But that wasn't good enough for us. We said, well, we need to know what's going on. We need a little bit more transparency here. So we asked that they amend it to provide a first report in May 2015, and then another one in the first report in November of 2019, and the second report in May of 2020. Thank you. About every 6 months. So that the public could keep tabs on what was going on there. Now the bill is waiting in the Rules Committee. And it's going to be selected. We hope it will be selected there. But to make that happen, we need you to contact your senators that are in the Rules Committee.
Flip over your handout.
And there's a handout, yes, thank you. Thank you, Taya. And the yes?
Maybe you're gonna say this, but I've been working on some other legislation that is also in the Rules Committee right now. And one of the things that we learned last week is that when something is in the Rules Committee, it doesn't.
Do you want the mic?
And is that something you're gonna say?
I don't know what you're gonna say.
Okay. You know what, let me wait till you're done.
You can wait till
I
I'm done.
apologize.
Yeah. All right, thank you. Lots of interest here in this topic. Yeah, this is great. So, another way we achieved success was by we found a great lobbyist a couple of weeks ago because of the longstanding members of our group that had an association with this person from years back. And so she really worked the people, the key people. She knows who the key people are. And so we were able to get access to them through her. And she's really been the catalyst behind the bringing this home, really getting it organized and having it happen. We also have one of our members of the board is really good at legislation. He can write legislation and amendments. In fact, he was instrumental in writing the original Health Security Trust Bill back 20-some years ago. So he used his instincts and his knowledge to actually suggest the language. And this helped a lot to have the actual language provided for the senators, because they didn't have to think of it themselves, of how to say it. They just took our suggested amendments based on what he wrote and stuck it right into the bill. So, let's see. So the action then is to contact the rules. And also, if your senator was a co-sponsor of the bill, there were 13 other co-sponsors besides the main sponsor, prime sponsor. Please contact them and thank them for co-sponsoring the bill. And if they're on the Ways and Means Committee, thank them for their vote in Ways and Means. there were some surprising additions to the roster of supportive senators coming out of Ways and Means. And so with that, I guess I'll stop and ask for questions, because I see another one and we had a first one. So let's see. Kate, do you want to go ahead?
I just have a quick clarifying on the bill. You talked about having an actuarial study, which I-1600 did not have. We had an economic one. Is there funding in the bill for that study, or is it just called for the actuarial?
Okay, so what it says is, let's see, I have the updated language here. Yes, it says, if funds are appropriated specifically for this purpose, if their funds are, so it's up to the senators to appropriate the funds, to decide that this is a worthwhile thing to have, or to find the funds probably first.
Isn't there an actuarial study coming out this spring?
It's a study in June, at the end of June. It's actually not a financial study.
Okay.
It's just a study of the systems around the world that are already in place for single payers, so they can determine which is the best for our
That's a key
state.
word when we're calling. We need to talk about
The financial.
appropriations for that.
Mhm.
Okay.
Sure, yeah. That would be Ways and Means again in the Senate, because it's Ways and Means in the Senate and appropriations in the House for different places. And the Rules Committee should be deciding this week when to put the bill forward, and so we'll keep you updated about when that hearing in the full Senate, or the consideration of the bill in the full Senate will happen. That will be a really fun time to be in Olympia in the gallery.
So there was a question back there, and then Carol, you still have a question?
I have a comment.
Okay, Carol,
Okay,
go ahead.
Well, only because it will help, it'll help the cause.
So a group of us have been working on some additional legislation that is also in the Senate Rules Committee. And one of the things that we learned in the last week or so is that when a bill is in the Senate Rules Committee, it is still perfectly fine to contact your legislator, but
hearing on Wednesday.
sorry. But the key thing,
Wow, sorry.
the key thing though is perfectly appropriate, and they expect you. When someone is on the Senate Rules Committee, feel free to contact any member of the Senate Rules Committee. So the list is on the piece of paper. The other hidden gem there is Cyrus Habib, our Lieutenant Governor. He is chair of the committee, and I believe Carl, does he vote?
Rarely, but he does have the power to pull a bill out for a floor vote.
Yes, and since
Put a
the
star
goal,
next to his name.
since the goal here is to get the bill out of the committee, it has to, basically someone has to adopt it, that's called pulling it, and someone has to adopt it or pull the bill, and then it can move forward to a vote on the general Senate floor. But someone has to do it, and they have a limited number of bills that they can do that for, and Cyrus Habib is one of the people who can do that, so call the Lieutenant Governor's office.
And typically, the prime sponsor does not pull a
Yes,
bill. It's
it's
considered bad form
bad
to
form.
pull your own bill.
We're learning. Anyway, that was it.
Are there any
Thank you very much, Carol. That's very, very important news. We have another question.
I don't know if this is more of a question, but I know when I'm canvassing, a lot of times you're talking to somebody, and my name's Merle Adler, and you're talking to somebody, and the issue that you're involved with is, it sounds like it's at a dead end. But there's a lot more to be coming, and maybe you're mentioning the Washington State one if you're doing the federal one. But there's some things that preclude, you know, those things from passing, which are challenges in court and such. One thing that has survived court challenges, has anybody heard of Healthy San Francisco County? Have you guys heard of that? Well, it's survived court challenges. And what it involves, and what Rod Dombrowski and Teresa Mosqueda, a council member in Seattle, are proposing or looking into, is to have a healthy MLK, you know, King County. And what is nice about that is that it can pass. One of the criticisms of passing anything at the state level in Washington or at the federal level is that you're passing something that maybe doesn't apply to everybody. You know, you don't have local control over it. Like Parmilla's thing doesn't cover everybody who's in the country. You know, it only covers people who are citizens. But the that's what I read in the paper.
No, we heard today.
Okay, well I'm wrong on that. I haven't heard that much on that.
Well,
but
and that needs to be corrected though, because that's not accurate. And people, all residents, all people who reside here will be covered.
And will it be total ownership? I mean, are you going to buy out the private infrastructure? That was one of the complaints.
Oh, well, that's a side issue. I don't.
Well, but
that would be something to be discussed in the committee.
But anyway, going on from that, Gavin Newsom was initially having to think of. He's the governor in California who was the leader of. The mayor of San Francisco once upon a time, but he had proposed to put that in his platform before he started to think differently about it. But one of the complaints, and you've heard of Canadian healthcare, is that it wouldn't be a national program, and your state programs wouldn't be national programs either. You know, we would pass it because we're richer up here.
You got to start somewhere.
But my question is, do you have something that will go national? And be able to pass incrementally, just like in Canada, where the province passed it. And if you had cities or counties passing a single-payer version of health care that would go from city to city to city, eventually you would be able to pass something.
Okay, and your question is, do we have that?
And my question is how many people would be on board with that, or at least be able to think of using that in their informational if they're going door-to-door canvassing? Because a lot of people,
well, I'll answer that question.
A lot of people hear this at a dead end.
Okay, so let me answer that to the best of my ability, which is we have several paths to provide health care for more people, and the national program would provide health care for everyone that is not guaranteed health care access for everyone who is not getting it now that is living in the nation when that law is passed.
Yes.
Meanwhile, there are states, 20 states in the United States that are working to get something passed in their own state first, because there is a lot of strong feeling and strong support for that states will be the place to incubate this idea. And also it can be a push toward, an impetus toward the national legislative, the Congress people, to get going on something, because the people here in all these states, these people want it, and there could be, our state could be the first state to put something into place that would really work.
It's about leverage. It's about leverage and amplifying the message and helping people really understand this. I mean, that's how it spreads.
So that's
synergy.
Yeah, the synergy, right? That's a good word. And you know, we're not opposed to people in the county like Teresa Mosqueda and Ron Demowski doing their own efforts in the city and the county. That's great. You know, we're going to need. They could answer the capacity question that was asked earlier. Or how are we going to have enough facilities for everything to everyone to be covered? Well, right now they do community clinics in Seattle and other areas of King County, and so that is definitely a component of the new system. I mean, it wouldn't be top down. Just you go to these huge buildings and you get everything done there. It's not that style. The style is whoever is working out in the community now will continue to be working. The private sector providers, the doctors, and the hospitals, the nurses, the anesthesiologists, everybody will continue working, but their rates will be negotiated with the state board that is negotiating rates for the state plan. The state will have the insurance plan. That will be the one insurance plan for medically necessary conditions. Insurance companies can still sell policies for Cadillac kind of things, like plastic surgery that is not medically necessary, different things like that. But there would be basic medical care. Medically necessary needs would be covered. Medical, dental, vision, mental, hearing, everything. So the vision is about how you pay for it, because we're already paying for it in our exorbitant pricing system. We pay twice as much. We pay 19% of our gross domestic product for healthcare in the United States. In other developed countries of the world, they pay half that. They pay 9%. and they're getting great coverage, and they have universal health care systems. So, and they aren't changing their systems. Everybody's happy over there. The Scandinavian countries with that Nordic capitalism. So, as far as actions then, what we need is action to get this off the ground. And so...
Can you go forward instead of backwards?
Oh, it's me. How do I need to
I was answering another question, I'm sorry.
Oh.
I'm sorry to confuse you.
Time for action.
Can we go back one? Should we go back one?
Oh, oops. Oh, I should go back.
Which one? This is where we were.
Yeah,
Okay,
so
we
I
were
think,
there. Okay, so, yes, okay, so for the State-Based Universal Health Care Act, that's like, we haven't heard much about that except for me today, but that's the first thing I talked about. Contact your congressperson, tell them you want them to co-sponsor the State-Based Universal Health Care Act, because we've got a great state here that's working on plans in our own state to get something in place to receive those funds once they're available in 2021. And the big way we're going to get there, you can also ask them to co-sponsor the National Improved Medicare for All Act as well. I mean, double email. But then the next action is to contact everyone on the Rules Committee. Thank you, Carol, and let them know this bill 5822 needs to be advanced onto the Senate floor to be considered by the entire Senate so that we can move forward. And I will tell you that, speaking of the city of Seattle, there actually is an action you can do tomorrow if you are in Seattle.
two ahead.
Oh, two ahead? I didn't see it there.
Hold on. One more. On your screen. There.
Oh, there it is. Can you scroll up? Or
That's it.
no?
This is,
Oh, that's it. Okay.
this is all the key information.
Okay, good. So at Seattle City Hall, they're going to consider a resolution to be in favor of the National Improved Medicare for All Act, Carmela's new bill, so 1384. So what you do is you go down to City Hall, sign up at 1:30 to testify if you want to speak to the council at their meeting that starts at 2 o'clock. They encourage people to come with their, if they have any swag, like, their t-shirts, their scarves, their signs, banners are encouraged. They want to have a big rally as well outside on the plaza there. And so prepare your comments, come to Seattle City Hall and give a 2-minute testimony. And they want to get a large variety of people, as huge a crowd as they can. And so that's something you can do tomorrow if you happen to be in the area at 1:30 and 2. Any other questions today?
I have a question.
Yes.
We were thinking about passing out postcards.
Oh, yes. All right, so we have an action, another action, which is you can actually write your comments on the back of this comment card, and they will be collected at the end of this meeting or at a future meeting, and then if you, they will be delivered to your senator or representative in Olympia at a future date, soon date. And another, we have a whole, are they to be distributed or?
We have, there's
There's some on the back
a
table.
lot of information on the back table. So, so to kind of connect the dots, I mean, there's a lot going on, and there's lots and lots of ways to get involved, and so there's some information at the back table, there's flyers.
And I want to let you know that there's a handy flyer here that tells you how to write to your senator or congressperson. And you probably already know this, but it's useful to make sure you have your name and your address, and so they know where you live, and so that and put your legislative district on there too, because we easily know who to give these to. And then on the back, if you don't have enough reasons, or you can't think of a really good way to say your reason for supporting universal health care, there's 12 reasons right here that you can choose from, or embellish for your own use. So those are on the back table too, and you can take those home. And you can also use this to send an email. You don't need to write a card if you don't want, but cards are really a visual and graphic proof to the legislator that this many people want this in their district. So we want the pile to be big.
And there's questions in the back.
And a question.
Yeah, I just wanted to say the resolution copies that I passed out to you, that into an envelope along with that resolution, and I think that'll say a great deal. Also, you'll know that it's been researched and debated and argued and fought over and hard won by Physicians for National Health Program. So they're on board.
So that's this one?
Yes, it is.
Okay. In case
Thank
anybody's
you,
confused
Kathleen.
like I did.
I didn't have that one on.
You're just saying you support for all those reasons.
So, in the interest of showing support, I have this kind of idea. Tell me if you guys think this is a crazy idea. I was thinking it'd be really fun before everybody goes out into the bright sunshine of the Northwest. I thought it'd be really fun to take a group photo today with the logos from all of the organizations that are here. We're not going to have time necessarily to do some of the photo petition ideas I have, but I thought it would be really great for us as a large group to come together and basically say we are for health equity. We are for health care for all in the United States. So I think, so just to kind of connect the dots, it might seem like these things don't go together, quite perfectly, but it's because we wanted to bring everybody up to speed on what's happening at the national level, and that still is what we really, really want. And the barnstorms are to really get momentum and emotion and to harness this strong feeling that we have that we don't just want this in Washington State, we want this nationally. So the thing, actually tomorrow is for the national thing, but we can also, because Washington State has a way of getting it right, we want to also really put our energy behind the state effort. So these things do really go together. Our human bodies and our voices are what connects the dots between the national movement and the local movement, and they are not unrelated to each other. We really are educating our neighbors, and we are really doing what we need to do, which is raise awareness and make this happen. So I want you to know that all these things do to go together. Some of our actions are going to be targeted towards the state, but we are still keeping healthcare for every single resident of our country as our focal point. So I'd love it if we could all get together and take a photograph together before you leave. Also, if you are at all interested, there is a petition campaign where you can write your name and your legislative district on a piece of paper and have your photograph taken, and then that could be added to a photo petition that Physicians for a National Health Plan is working on. So there's a few actions you can do before you leave today. I hope you'll come tomorrow to the rally at Seattle City Hall. Contact your senators, contact the Rules Committee. Please sign up on that clipboard to be on the Healthcare for All Rapid Response Team. When they find out that something's going to get a hearing, you get an email. And then and if you have the day off, or if you can take a long lunch break, or a really, really long lunch break, or you call it sick because, hello, healthcare, so you'll get an email. So you can decide if you want to do that. Please consider doing a larger action with a barnstorm or a crowd canvassing. So all these things are things you can do right away.
Could you do that photographic picture? Could you send that to Camilla Giamon?
Yes.
And the caucus?
I love that idea.
With all of our different logos?
Yes, I made a
I just tweeted it and tagged her.
Yes.
Yeah. So I have I've made a logo for each of our organizations for us to hold in the picture. I thought we might have a little bit more time than we actually do, but if you wanted to write your name and legislative district on one of the photo petition forms, you can do that. So I would like to ask everyone who's here to pose for a picture before you go. We'll send it to Pramila. We'll send it to the Rules Committee. We'll send it to whoever we can. But I think that I want to harness the energy in this room because you guys, we really do make a difference. In every action we take, we are definitely making things better for our neighbors and friends and for the nation. So please be in our photo.
You want to do the photo